many different subscales, and there are many different ways that people define quality of life. Some of it is, again, physical well-being. So things like pain, people define quality of life as not being in pain primarily, but dealing with persistent nausea, fatigue, just being in bed all the time. Those are things that we look at after an extensive procedure like this. Other things like social, family well-being doesn't necessarily change after a procedure like this, but it is important to note that when patients have, let's say, unsatisfactory social, family dynamics, meaning that the absence of relatives or a supportive environment, those are things that ultimately relate to quality of life and do persist afterwards. Emotionally, anxiety, just being sad, nervous, the risk of something coming back is a very real aspect of quality of life, and it can certainly contribute to the outcome of the operation. More importantly, functional well-being, enjoying life, just going back, if people work, going back to work, those things are expected. And overall, what we expect with regards to quality of life when I recommend a procedure like this, again, is it's not so much the survival benefit, which is key, but it's including that in our shared decision making to ensure that we can achieve those things. To sort of sum up and say the things that we do see related with an improvement in quality of life, primarily patients that are of younger age because they do recover quicker, patients that have less disease, or what we call a lower peritoneal carcinomatosis index, so they have less disease scattered throughout the belly, the ability to achieve a complete removal of all the tumors is certainly associated with an improvement in quality of life, and these things have been studied. As far as the presence or absence of an ostomy, which are things that we talked about, anytime we do these operations, that does affect quality of life adversely for obvious reasons. And with regards to what we look at in terms of an enhanced recovery pathway, I think those are things that we've recognized that do improve quality of life with other surgeries. And as a result of that, especially with many of our patients, the goal here is to give them, again, the gift of time.